Good afternoon and welcome to Living Well with Adena. I'm Dr. John Gabus, the Medical Director of Community Partnerships. So today is a watershed edition. We have with us Dr. Kirk Tucker, who will be talking in just a moment about the CDC's new recommendations. With as many people vaccinated as are, we're able to consider changes in how we protect ourselves. The governor and the Department of Health have released their health orders, their public health orders, as of June 2nd. So thanks to you all for getting vaccinated, and thanks to you all for keeping up the social distancing that's helped us get to this point. So Dr. Tucker, what are the newest recommendations that you might share with us today?
Certainly. Thank you, John, for inviting me out today. So exciting news, and John's right, it's sort of a breakthrough or a very symbolic moment today here for Living Well with Adena, because with the new orders that apply in this particular setting, because John and I are all vaccinated here with the crew, we no longer need to wear our masks here in public. So that is good news. So I also want to echo John's thanks to those in the community that have gotten vaccinated and for trying to do our best to wear the masks and to stay socially distant. So where we're at today, and based upon the current incidence level of the disease, the few number of people that are turning up positive, the governor's lifted these orders, and we are now, as vaccinated folks, free to go about our business in public without masks on. So there are a couple of exclusions. Those exclusions do include healthcare facilities. So any facility that provides healthcare to people in need or those that are sick is still required to function under a masking order. So you will notice if you come to visit us here at Adena that when you enter any of our public entrances, you'll be asked to wear a mask throughout your stay. And this at this point is really to protect the other folks coming here that come here for care, some of which are on powerful medications that suppress their immune system or have diseases that they would not do very well to get COVID, and that even with a vaccine, that vaccine might not have taken for them. So that's where we're at, and I think it's a good day. At the health system on a day-to-day basis, we're down to about 1 or 2 inpatients with COVID. Now this is amazing given the fact that we peaked out at 60, and this is a health system that on most days operates between 150 and 180 total patients. So this is really good news.
That's great. That's great. And thank you for your leadership and your guidance through this and sharing the information and the updates. We were all very anxious for this moment where we could take our masks off in a controlled environment.
Me too.
But when you see patients, when I see patients,
yes,
we have our masks on, and then we're protecting those who are still at risk.
Yes. Yes. So the key is if you haven't gotten your vaccine and you still have questions, please feel to ask your primary care provider here at Adena. In 7 or 9 offices of primary care, you can now get the vaccine. So if you have questions and you're holding out and you just want to ask your trusted physician, please come and do that, because you'll be given the opportunity to get that shot here at your doctor's office. Actually, your office and mine are two of the sites, and I saw patients this morning, and one person walked out with being vaccinated. Perfect. I hope to have some this afternoon. Yeah, good. Okay, thank you very much, Thank
Kirk.
you, Dr. Gabus. I appreciate you.
Okay, and now for the topic of our discussion today, it's maintaining a healthy weight. And we all struggle probably at some point in our life with our weight. And how do we approach that weight loss with success, with sustainability, and with good healthy outcomes? I know that in Ross County, obesity is at a higher prevalence than in other counties in Ohio. So joining us today is Dr. Yemi Olatunde, who is a board-certified internal medicine physician, and she is now board-certified in obesity medicine. And I expect that there are going to be some questions about maintaining weight and obesity, and how do you lose weight, how do you keep it off. So be sure if you have questions to put them in the chat, and we'll get to those as best we can. All right, Dr. Olatunde, welcome.
Thank you.
Tell us, what does it mean to be an obesity physician or a board-certified obesity physician?
So to be an obesity physician, you have to write a board examination. And there are two routes pretty much to get the certification. You could do a 1-year fellowship in which you will do the board certification afterwards, or you could do a self-learning path in which you have to have 60 CMEs, continuous medical education by yourself, and another 60 CMEs in which you go to a board certified learning of 1 week with board review and write the board certification, after which you become boarded to see patients.
Wow, so that's not just you have an interest in it and you're able to sign up for these credentials. It takes a lot of effort.
Absolutely.
Okay. How did you and your family get to Chillicothe?
Good question. So we were moving from New York and New Jersey. We were looking for somewhere quieter where we can raise a family in a family-friendly environment, and we applied to Chillicothe, and we met you, Dr. Davis, in one of our conversations, and we loved the warmth and the fatherly love we received, and which was one of the reasons why we decided to come here, and it's been wonderful since.
Good, and I hope you still feel that from all of your Adena family. So
yes, we do.
we're very glad that you and your husband are here. So what is obesity? How do you define obesity, and maybe how do people end up with a diagnosis of obesity?
Obesity is a medical term. I would prefer to refer to as excessive weight gain. So obesity is a state of excess body fat in which it leads to health risks to the body. And this can cause various health risks from the head even to the toes. So in the brain, it can cause chronic headache, causing hypertension. It can engorge the vessels in the eyes, causing decreased vision. It can cause congestion or compression of the airways, leading to sleep apnea. It can affect the heart, causing heart failure. It can compress the esophagus, that's the tube that goes to the stomach, leading to reflux disease. And the worst one that we don't like is the one that covers the abdomen, because when it covers the pancreas, it can decrease the body's insulin, leading to type 2 diabetes, compress the kidneys, leading to hypertension, and all the works. Osteoarthritis because of the weight the body is bearing. And so obesity is a medical term, but excessive weight gain is the one that actually leads to the health risk. And the definition is pretty much when the BMI, that's the body mass index, this is pretty much your weight in relation to your height in kilograms per meters. When it's above 30, we say that is obesity. And the normal weight for every person is between 18.5 to 24.5. Anything less than 18, it's underweight, and between 24.5 to 30 is overweight. And once you move from that normal weight, the risk can continue to increase to obesity and leading to a lot of health risk.
So I am moderately obese. My body mass index is about 32 to 33. And I'm a human being, so I've had to pay attention to my weight my whole life. Is there a genetic component to this? Is there a brain chemistry component to obesity? And we'll talk about willpower after you answer the hormonal questions, but what about willpower?
Yes, so I'm glad you asked that question, because a lot of us have struggled with our weights at different times of our lives. And talking about the genetic or hereditary part of it, we know that certain families have genetically large, they're genetically big. So this can predispose you to having obesity. But that doesn't mean that you necessarily have to be obese. It just means that a lot of work has to be done if you have that tendency in the family. Even in utero, people that are obese do have the tendency of having obese children. So there's a genetic part of it, and that's where the willpower comes into play. Willpower meaning that the choices you make in the food you eat, how dense the calorie, your portion sizes, the timing of your food is very important. So diet is also very key. The fact that you have family history of obesity does not necessarily mean that you're bound to be obese.
So you use the word diet, and I think it has two meanings. Diet, as in dieting, is where you're limiting calories or you're trying to lose weight through limiting food intake. And diet, which is a descriptor of what kind of foods you eat. Can you talk about dieting and proper choices for foods?
Okay. So when I talk about diets, I'm talking about the healthy, regular choices we make with our food. So eating less calories, less of carbohydrates, less of ultra-processed foods, cookies, foods that are saturated in fats, just avoiding regular unhealthy food. That's just a healthy diet. When we talk about dieting, we have different forms of dieting. The keto is one of the popular ones. There's paleo, there's the DASH diet, Mediterranean diet. There's so many of this dieting. Where they are good with fast and quick weight loss, most of the time they're not sustainable. So I get a lot of patients tell me, oh, I did my keto diet for 6 months, I lost 20 pounds. In a year, I've gained 30 pounds back. Yeah, that happens because when a dieting process is very strict, it's not easy to sustain. And so once you stop it, the body chemistry, the hormones, they tell you you're depleted, you have to replete because you're not at your set point. And so the hunger hormones, they kick in and make you eat extra, and so you end up gaining back the weight.
So that's a difficult situation.
Absolutely.
How would you recommend somebody go about beginning a weight loss program? So if it's a drastic change, human nature doesn't like to make drastic changes. They're hard to sustain over time. What small steps could you recommend for somebody who is overweight or obese? What steps can they take just to start that journey that would be a healthy start?
Okay, very good. Starting the journey, it might be a long one, and I have to tell you, you don't have to take that journey alone. You might want to seek an expert who would help you walk that journey and describe the kind of meals you like and the ones you're allowed to eat in proportions, and also prescribe a set of physical activity for you. Ideally, even if you're not trying to lose weight, in order to maintain our weight, we should be having at least 150 minutes a week of physical activities. So prescribing a physical activity regimen, and also, if necessary, medications can be used to help, curb your appetite and help you to lose weight that are FDA approved and has been proven to be safe.
So if I'm hearing you correctly, it sounds like there's no shortcut to sustain weight loss.
Yes, I would say there is no shortcut. It's a long journey, and it has to do with everyday choices that we make, and sometimes it's not easy, but like you say, a habit just has to develop, and once you create that habit, it might be sustainable.
Mm-hmm. I want to remind our viewers that we are unmasked because of the lifting of public health orders, as well as Dr. Olatunde and I and our crew have been vaccinated. And we are socially distanced, and this was a major advance for our community. If you've been vaccinated, you can gather in public without a mask, without high risk to yourself or to others. With that being said, COVID kept us at home a lot.
Yeah.
It kept me in close contact with my pantry. And stress was a component for many people, and there's an emotional component to our relationship with food. Can you talk some more about that?
Yes, absolutely. So, like you said, stress can predispose to weight gain. So also is lack of sleep can predispose to weight gain. And also what I want to tell our viewers is sometimes not doing something is not a reason why we have to be close to the refrigerator or to the pantry. It's been shown that the satiety place, that's the place that craves things in the brain, is actually linked to where the amphetamines and the drugs also work. So they help to make you feel good. So in order to curb this, substituting with something else that would, cause you to enjoy life could actually be better than the food. A lot of us, unfortunately, we find ourselves doing that, and it's not just you. A lot of us find ourselves doing that, but just paying attention and making that right choice, like I said the other time, making the right choices of substituting something healthy for something that is not healthy. So as we get older, everything that goes into the mouth also goes to the system. So we need to pay attention to the choices of the food and the timing of the food, the calorie content, the portion. This can help us to maintain a healthy weight.
Could you talk some more about the timing of food? Lots of times my patients will tell me, well, I just eat one meal at night, or I get off work at 11 o'clock because I work 3 p.m. to 11 p.m. and I don't want to eat because it'll make me get fat. Tell us about the timing and how that works.
Yes, I get that a lot. It's very interesting that exactly that conversation my patients tell me also. So it's better if you eat 3 small portions of meal a day. Have a healthy breakfast, a healthy lunch, and a lighter dinner. Why? Because most of the dinner is, if you don't work and exercise, you end up gaining it in pounds. As opposed to if you just eat once a day, you go to work and you come back in the evening and just eat a large meal and that's it. You're more likely to gain weight rather than when you eat small portions and you time it out. And if you miss your breakfast, for example, you tend to eat more for lunch and for dinner, and you might not lose weight that way. As opposed to if you have something, even if it's a small yogurt or fruits for breakfast, you eat a healthy lunch and an earlier dinner. So the timing is very key. At least you should be having, before you go to bed, 2 to 3 hours of physical activity when you're moving around before you go to bed. So the timing is key.
So sitting, watching television, eating popcorn or chips doesn't count as physical activity.
Absolutely.
Okay.
That's sedentary, and that would, of course, make you gain weight.
Okay. So one of the things I want to remind our viewers today also is please submit your questions in the chat box. We would love to hear from you about your concerns with obesity. So we've talked about the conservative approach or the individual approach to weight loss. Can you talk about what medicines are available to people who want to have a help or a tool to help them along with diet and exercise? Could you talk about that?
Sure. There are a couple of medications that have been FDA approved and proven to be safe in different individuals. That's why it's important for you to see an expert based on your comorbidities and the other medications you might be on. There are many medications. We have the phentermine, we have the phentermine and topiramate that is marketed as Qsymia. We have the liraglutide with the higher dose that is marketed as Saxenda, and there's a new one, the Wegovy now, that I was just approved a couple of days ago for weight loss. So we have a couple more medications like that. We have the Contrave that is also proven to be safe. However, there are contraindications to certain of these medications, and it's important that you see an expert and you also follow up in order to be safe and be effective with medication use.
So some of those medicines are actually amphetamines, and whenever you're talking about the side effects or the comorbidities of obesity, we have many of our patients who are obese who also have high blood pressure. And would it be safe for somebody with controlled high blood pressure to take those medicines?
Yes. Once the blood pressure is controlled, they can take an amphetamine-based like the phentermine, I suppose that's one you're talking about. Yes, if the blood pressure is well controlled, that's not a contraindication. But we have to make sure, especially if amphetamine based, that they don't have any heart disease, no valvular heart problems, no coronary artery disease or heart failure.
And I would expect that part of that treatment program would also be frequent contact with their physician.
Absolutely. Insurance actually mandates for you to see your physician at least once in 3 months or once every month for you to continue to prescribe those medications because they're controlled substances.
And I think you would, I as a patient would want that contact to get feedback, to get guidance. I think that's a very important component, knowing that your physician's in your corner helping you.
Yes, absolutely.
Okay. Now let's switch to those newer medicines. And in our conversation before we went on the air, we were talking about how it changes the hormonal side of regulation of food leaving the stomach and being absorbed. Can you give us an overview of how those medicines work and how they lead to weight loss?
Okay. So we're talking about the GLP-1 receptor agonist, the new one that was just approved, the Wegovy. It works exactly the same way like the liraglutide or the Saxenda. So pretty much they work in two ways. They work in the gut as well as in the brain. So in the gut, they help to make you full easily, so you tend to eat less. They work in the brain to suppress the hormones that are telling you you're hungry, so you feel less hungry, and so you're able to eat less and lose weight that way.
Okay, so if I heard you right, there's a coordination between the stomach emptying and what the brain senses as being full, and then how that food is used in the body, and these medicines change that. Do they change it in the brain or do they change it in the gut?
Both. They have what we call transmitters that work in the gut that helps to make you feel full easily, and they also work in the gut and the brain that make you feel full easily, and in the gut they decrease the absorption of this food and you tend to eat less.
So do you think that there are people who have obesity who have hormonal imbalances that cause their obesity, and it's not just that they don't have the willpower? So do these medicines get to the root cause of some of the reasons for obesity?
Yes, so I would always prescribe for my patients to see an obesity specialist where we can find out the root cause of obesity. If it's due to hormonal imbalance, most of the time, if this hormonal imbalance is corrected, like for thyroid, for example, a lot of patients gain weight before they discover they're hypothyroid. And once they are put on medications, they might lose that weight and their thyroid level becomes normal. There's some other rare, but they do happen, hormonal imbalances that can lead to weight gain. So it's important that the doctor does blood work to find out the root cause, depending on the history and the physical examination, and then prescribe medications when necessary.
So we've talked about diet, what we eat, dieting, how we eat what we eat. We've talked about physical activity. We've talked about when to eat and how to spread that out over time. And we've talked about medicines. One of the things that we haven't mentioned yet is surgery. When would surgery, also called bariatric surgery, when would that be indicated?
Okay, very good question. So when the BMI, that's the body mass index, reaches above 35 and they have other comorbidities, that is risk factors like blood pressure, like diabetes that is not well controlled, like CPAP NAD that is not well controlled, like depression, when they have all this, at least one or two of all these comorbidities, then as per insurance, they will be qualified to have a bariatric surgery. But the BMI has to be more than 35.
Where I've seen it be most effective is in those patients who are very obese with the BMI greater than 40 or greater than 50. and it's hard for them to get up and move around because of their weight. And do you have guidance about people in that circumstance? How would you approach your physician to say, what are my options in surgery? How would you approach that with them?
Yes, so yeah, we see a lot of patients with BMI over 50 and sometimes over 60. And sometimes when the set point is really high like that, the best effective will be to have a weight loss surgery in order to reduce that set point, and then we can now manage with medication. It's like you're throwing, sand in a big pool. If you're trying lifestyle for someone that has difficulty moving around or physical activity that is impeded due to osteoarthritis. So many of our patients, they would actually benefit from weight loss surgery first before we manage with other medications.
Okay, so and I know that it's not for everybody.
Yes.
And that the emotional relationship with food that we have in those people who are very obese, that has to be addressed before any kind of surgery would be effective, I would think.
Yes, absolutely. Before bariatric surgery, before the weight loss surgery, they see a team of psychologists, dietitian, nutritionists, pulmonologists, cardiologists. They do a lot of work, and the insurance actually indicates that they do some weight loss with lifestyle changes before they can be approved for surgery. However, it's very important that the patient is willing, because that's one thing that many patients are not willing to do surgery. They don't like, they've had a family member or a friend that's had complications, and so a lot of patients are not willing. But I would say that, this weight loss surgery is supposed to be individualized. So you can't listen to a friend or a family member. You have to see an expert who is willing to walk the journey with you and describe all the options you have and will fit in to what will be best for you.
So as I confessed earlier, I'm moderately obese, and I don't have diabetes or prediabetes. But if I were in that situation where I had prediabetes, would weight loss help to prevent the diabetes from becoming full blown, or to be a true diabetic?
Yes, weight loss is very directly related to controlling the blood sugar. What it does is, when we lose weight, at least 5 to 10%, our body is able to sense the insulin we produce more. So it definitely controls the blood sugar and the number that we see with A1C, with the average. So the A1C gets better because the body itself is able to sense the insulin more and treat that naturally.
If I heard you right, you said 5 to 10% weight loss. So say for sake of example, I weigh 230 pounds and I lost 23 pounds. That would have a dramatic impact on my health?
Yes, it will have a direct impact on your blood pressure and on your blood sugar. And I've had patients that has lost almost 10% of their body weight, and they don't have to use the CPAP machine anymore.
Oh, that's great.
Yes.
Okay. We do have one question. What are some easy, healthy lunch ideas for the work week?
Oh, good question.
Since it's about lunch for us, huh?
Yeah. So pretty much a healthy meal with less of processed foods, less of the fried chips and chicken nuggets, or processed foods. What we want to avoid is processed food. Whole grains are good. Plants are good. Natural plants are good, and of course nuts are good. A lot of fruits and vegetables. Salad dressing that are very low in sodium and low in calories are good. So chicken is good. Chicken, fish, without the flesh. We want to avoid a lot of red meats, a lot of processed meats, because they are bad. and they can also cause a lot of cancers too. So pretty much staying healthy with low carbohydrates, lower fat, a lot more fruits and vegetables, and of course water.
Okay. So one of the areas that we haven't talked about is meal planning. So if you have a busy work week, if you don't plan your meal, you're more likely to choose something that's quick and easy, and because it's quick and easy, it's likely highly processed.
Yes.
Do you have any thoughts or advice on meal planning so that you don't find yourself in a situation like that?
Yes. So a lot of working folks have difficulty with this because they work all week long. But I'll say planning your meal before the next day is very important and could help. Planning your meal, you can put it in the refrigerator, have a healthy breakfast or a protein bar with water. A cup of coffee is good in the morning, and for lunch, during the lunch break, have a bowl of salad with, bread is also good, but not a big quantity. Yeah, chicken is good, something balanced. I always tell my patients, I'm avoiding, when I say cut down, and I mean cut down, I don't mean just eliminate, because that's strict and that is not sustainable. And once that kind of diet is stopped, patients tend to gain more weight. So planning a meal of limited carbohydrates like the rice, pasta, bread, potatoes. We want to cut back on that. We want to cut back on the cookies and the chocolate and donuts that people bring in their office. You might want to look away sometimes. And in the morning you take your food to work, and even if you have to buy food at work, make the healthy choices.
Okay. So I noticed that you did not say ice cream. So is ice cream okay or not?
Well, I'll say limited ice cream. I know a lot of people love ice cream, and limited, maybe as a treat once in a week or once in 2 weeks.
Sure. Sure. Is there anything that we haven't covered that you think it's important for our viewers to know?
Yeah, so I think it's important for all of us to just know that obesity is not a taboo, is not because of, oh, this person is not disciplined, does not have willpower, or does not know the way to the gym. It's actually a lot of hormonal, a lot of environmental, sometimes hereditary, sometimes diets and limitations to physical activity that might predispose an individual to weight gain. So when we see someone that is battling with their weight, you can do well to refer them to an appropriate center where they can be helped. And I just want you to know that it's a journey, it's a lifelong journey, but you don't have to take it alone. Adena has a facility now that we can guide you towards getting weight loss and referring you to higher care for weight loss surgery when necessary.
Okay. Thank you so much, Dr. Olatunde. Dr. Yemi Olatunde is board certified in internal medicine as well as obesity medicine. And we've spent the last half hour talking about the journey of being at a healthy weight and how to maintain that. And unfortunately, there are no shortcuts, but there are certainly plenty of tools that could help you to maintain an ideal body weight. And that wraps it up for our Living Well with Adena session today. Looking forward to coming back next episode with no masks on. But remember, in a healthcare facility, you'll be asked to wear a mask to help protect those who may be immunocompromised or those who are at risk still of getting COVID and having a bad outcome from that. So thank you very much for joining us, and look forward to seeing you at our next episode. Thank you.
Thank you.